2 doses of Pfizer's coronavirus vaccine is 94% effective at stopping over 55s from falling unwell with the disease, according to a major study. In the data of more than 500,000 people who received 2 shots of the jab found patients were also 92% less likely to develop the study, which suggests Pfizer's vaccine works almost as well in the real world as it did in clinical trials. Compared 600,000 patients given 2 doses of the jab against a similar-sized group who had matching medical histories but were not inoculated. The findings will be a boost to lockdown easing plans in the UK, where ministers are waiting for concrete evidence the jabs work before lifting restrictions. The vaccines do not need to prevent symptomatic infection entirely to end the lockdown, though it would be an added bonus. Their main purpose is to drive down hospital rates and ease pressure on the NHS. Researchers from Israel's largest healthcare provider, who led the project, said Pfizer/BioNTech's coronavirus jab was even more effective 2 weeks or more after the second shot and worked in all age groups. This will be another boost to officials running Britain's vaccination program, who delayed giving Brits the second dose in order to get wider vaccine coverage quicker after an outbreak of the highly infectious Kent variant. Israel is only using the Pfizer vaccine and insists people must get the jab 3 weeks apart. Britain has said people must get their second shot within 12 weeks of the first. The 15 meters includes over 70s, care homes residents, health and social care staff and people who are extremely clinically vulnerable to COVID, including patients with terminal illness. Over 60s in some areas leading the way in the vaccine rollout have already been. NHS bosses say local health teams can make their own way down the priority list, so long as they have attempted to reach everyone. Mr. Hancock said today uptake of the vaccine so far had been much higher than expected, with more than 90% of over 70s turning up to their appointment. The figure was a little bit lower than 90% among healthcare staff, he said, and only around 2/3 of social care workers have had the vaccine. Over the weekend, data showed the number of COVID deaths in over 85s was falling twice as fast it is in younger Brits. In the first sign of the vaccine drive, share this article, share 2.7k shares, but Mr. Hancock said today it was still too early to see a clear-cut effect because of how long it can take for immunity to kick in and for patients to fall seriously ill. Meanwhile, experts at the Weizmann Institute of Science who have been assessing national data in Israel, said there had been a sharp decline of hospitalizations for the first time for people aged 55 and older. Rand Balazar, Plalat's chief innovation officer, said the study shows unequivocally that Pfizer's coronavirus vaccine is extremely effective in the real world a week after the second dose, just as it was found to be in the trials showed it was 95% effective at stopping symptomatic infection. Efficacy is normally always higher in controlled studies because researchers use more young and healthy people to make the trials run smooth. It comes as England's COVID vaccine rollout enters its 5th phase today as ministers discuss plans to lead the country out of lockdown. In another big step towards a return to normality, people aged 65 and over and younger people in at-risk groups will now be offered the COVID jab. What are the UK priority groups for vaccinations? 1. Residents in a care home for older adults and staff working in care homes for older adults. 2. All those 80 years of age and over and frontline health and social care workers. All those 75 years of age and over. 4. All those 70 years of age and over and clinically extremely vulnerable individuals, not including pregnant women and those under 16 years of age. All those 65 years of age and over. 6. Adults aged 16 to 65 years in an at-risk group. 7. All those 60 years of age and over. 8. All those 55 years of age and over. 9. All those 50 years of age. Rest of the population advertisement. Almost 1.2 million letters are due to have landed on the doorsteps of over 65s and the clinically vulnerable over the weekend, asking people to log on to the National Booking Service, NHS. A further 1.2 million are due to arrive this week, with those to receive a letter able to choose from more than 100 vaccination hubs or almost 200 pharmacy services. Wales, with its much smaller population than England's, started inviting over 50s to. Similarly, Northern Ireland has been inviting those aged 65 to 69 to book a vaccination at 7 regional centres since the end of January. Scotland, which has been accused of moving too slow with its slow rollout, is still to offer the jab to all 4 top priority. Last night, Mr. Johnson described the country's rollout, the 3rd best in the world in terms of vaccination rate, as an extraordinary feat. He also said that the country can go forward with great confidence. And, in a further boost to millions of beleaguered Britons, ministers are set to discuss plans to allow for shops to reopen, families to be reunited and self-catering staycations to be given the go-ahead if COVID-19 infection rates continue to plummet amid the vax. Plans to ease lockdown were boosted yesterday by figures showing the dramatic impact vaccines are already having, as Boris Johnson last night confirmed the country had hit its target of 15 million vaccinations ahead. The Prime Minister said the number of new cases has already dropped very considerably, preparing the way for lockdown measures. It is thought that this could mean the reopening of high street shops within weeks, as well as the easing of restrictions on outdoor exercise and social. Ministers are also said to be considering plans to allow for families of a single household to travel across the UK for an Easter holiday in self-catered. It has led to growing hope that families will be able to meet outside by Easter as early as next month to allow children to reunite with their grand. It comes as Health Secretary Matt Hancock set out yet another ambitious goal as he aims to roll out 32 million jabs to all those at risk in just 10 after the over 65s and 1664s with underlying health conditions, two groups which together contain more than 10 million people. The government aims to vaccinate the 55-60s and then the over 50s, but the remaining adult population, around 21 million people, will then be offered their jab. Boris Johnson said last week that it was too early to book holidays as he urged people to wait until the government had issued a roadmap out of luck. But there is now renewed optimism sparked by the UK achieving its landmark target of vaccinating 15 million a day early, hailed by the Prime Minister as an extraordinary